Hello everybody, welcome back. This is Dr. Marc DuPéré, plastic surgeon at the Visage clinic here in Toronto, Canada. I want to first say thank you to my patient for agreeing to this filming. We just performed a mini arm lift under local anesthesia with a very mild sedation. So my patient is awake. This is an easily frozen area with local anesthesia. The sedation was given intravenously for added comfort. The mini arm lift is a mini procedure. It's a mini recovery. There is lesser power to this procedure compared to the full arm brachioplasty. But the full arm brachioplasty is a long incision that's visible, goes all the way to the elbow. It's a great, powerful procedure for a patient who've lost 50, 75, 100 pounds. So after weight loss, there's so much laxity in the skin that the scar becomes a lesser evil, I say. But with my patient today, she's a very athletic, fit lady who just has the classic ladies laxity in the arm, as we see in the 40s and 50s after pregnancy and around menopause. So this technique is an incision in the underarm, and basically what we do is I remove half a circle in the arm area. And that distance from here to here varies between 6 and 8, depending on the length of this incision. So basically, it's something like that. The little challenge with this technique is this line here is shorter than the line here. So when we cut here, this is longer than here. So when we close, we have to cheat a little bit. So we pleat the skin 2 to 1, 2 to 1, 2 to 1. A little bit like a designer would do for pleats in a pair of pens, for example. So the pleats, you see them, they're very small. I close carefully with the 2 to 1 principle. And then the pleats, I will close them with some black sutures so that they will disappear. Usually within a month or so, this is all gone and we have a nice straight line. If we remove too much skin, there'll be some issues with not being able to lift the arm, and or the scar may open, and or the scar will widen. So I keep it to this rule, 6 to 8 centimeter or so. Patients are welcome to let it heal, and then it can come back 6 months or a year later, and we can repeat this procedure to get more power, more effect on the lift. Now this technique has better power in lifting in the inner third, inner half of the arm. And for that reason, I don't recommend liposuction with this particular technique, because liposuction all around the arm will give looseness and laxity all over the arm. And this technique will not address this part here. So it's best not to do liposuction with this technique. Whereas with the full arm brachioplasty, I go with a significant amount of liposuction since the skin is excised. This again is done under local anesthesia. Often we offer a mild sedation for added comfort, just for customer service. The pain after this procedure is relatively small. I would say 2 out of 10 for a day or two, after which there'll be probably no need for medication. Some patient will take a mild narcotic. Some patient will just go on Tylenol and Advil. It's important post-op to not be too excessive in the range of motion. So I always recommend to stay at 90 degrees as much as possible. And whenever we go higher than 90 degrees, to go very slowly for the first few weeks. So I want to thank my patient again for agreeing to this filming of this wonderful, simple procedure that we perform very often at Visage Clinic during our minor surgical days. This is Dr. Marc DuPéré, plastic surgeon, Visage Clinic here in Toronto, beautiful Canada. Thank you for watching.